Hi, my name is Joseph Irizarry. I have my patient Luis with me today, and I'm going to be going through a basic eye examination video. So I'm going to go through the steps of what we look for during an eye exam. So the first thing that we're going to do is we're just going to go through some palpations of the head, or the face around the eye, the bones and structures like that, to see if there's any tenderness or any type of deformity that we can feel for that may not necessarily be obvious to us. So what we're going to do is we're going to go through, and we're going to go through like the frontal bone, the nasal bone, the orbital margin right around here, and then the zygomatic bone, as well as working down to the maxilla. Any pain or discomfort with that?
No.
Okay, so I'm just going through the structures that are around the eye, the bones that are around there, to see if there's any tenderness, anything, if there's been trauma to the face, that there may be a potential fracture that may not be noticeable. Also, while I'm doing that, I'm going through some kind of general inspection. While I do this, I'm kind of looking to see, are his eyes kind of at the same level? Is one kind of depressed or lower down than the other one? Also, is there any swelling like raccoon eyes, black eyes, any other deformities or possible like lacerations? There's what are called corneal lacerations that kind of have like a teardrop deformity in the front of the eye. So I'm looking at all those to see, because there could be potential of like a blowout fracture or orbital fracture where a blunt force trauma occurs and the affected eye is maybe sucked down a little bit, or also called a trapdoor fracture. So we're looking for those kind of during our general inspection. And I generally do those while I'm going through my palpations. Alright, so now we're going to do a Pearl exam, which stands for pupils equal and reactive to light. So what I'm going to do is I'm going to walk the patient through the steps necessary for that, but essentially what we're looking for is when I shine a light into each eye separately, we're going to see if the pupils are supposed to constrict when you shine the light on them. So what we're going to do for this process is I'm going to instruct the patient that we are going to start with their right eye. So they're going to cover their left. So they'll cover their left eye. I will shine the light for about a second. No more than that. You don't want to blind them or do any damage that way. And then I'm going to pull the light away after a second, look to see the reaction of the pupils that should constrict. And then I'm going to quickly go to the opposite side and do the same thing. And we're going to compare the two to see if there's any possible damage or any like either be a nerve issue or something like that. So go ahead and cover that eye for me and open up. Okay, then cover the other. Okay. Alright, so in a normal situation we would use a pen light, but in this situation we're just using the light tool on the phone. But in this case, looking at both of his pupils, and for the 1 second duration, they both constricted equally, and then I took the light away and his eyes adjusted back to the lighting of the room, they opened up accordingly. So they both reacted equally, which is what we like to see. So now we're going to go through an eye tracking test, which we're going to look for more nerve and also muscle, testing the muscles that move the eye around. So what we're going to have him do is that we're going to have him follow my finger, and I'm going to just kind of walk him through real quickly the steps of that. So what I want you to do is I'm going to hold my tip of my finger out here, not too far away from him, and then you're just going to follow the tip of my finger with your eyes. You don't want them to move their head or neck, just follow with their eyes only.
Okay.
Good. So kind of going back over that, like I said, we're not going to have our finger too far away from their face, and we're just going to go from a pattern of going side to side, and then you come back to center each time, up and down, come back to center, and then you go diagonal as well. And so when we're looking to see if there's any nerve issue that would be causing one eye to be like hesitant or kind of react late as opposed to the other eye, also we're testing the muscles that move the eye themselves. So now we're going to go to a Snellen vision test. So now we're going to go and assess his vision using the Snellen eye chart. Basically, the couple of things you want to keep in mind with the eye chart is you want it to be at eye level for the patient, so it's not straining them, and it's kind of easy for them to see. But what we're looking at is the classic lettering, and they have numbers on the sides, and we're testing if they have emyopia, which is 20/20 vision, myopia, which is nearsightedness, and then we have hypermyopia, which is farsightedness. And that's what these fractions represent. So basically how it works is we place this against the wall at eye level, we designate a spot that's 20 feet away, and then we go through line 1 as far down as they can see without making too many mistakes, and then the last line that they can read without any mistakes from side to side, from left to right, we look at the fraction that corresponds with it, and if it's 20/20, that means that they can see at 20 feet away what most people can see at 20 feet away. If it is 20/15, that means they can see at 20 feet away what most people can see at only 15 feet away, and if it's 20/40, they can see at 20 feet what most people can see at 40 feet. So I'm going to walk my patient through the Snellen eye chart vision exam now. And before we get going on the Snellen eye chart, I just want to make note of one last thing before we get started, which is whether or not the patient wears corrective lenses and or glasses. So do you wear contact lenses or glasses at all?
No, sir.
Okay. If they were wearing glasses, or if they do say that they wear contact lenses, you will have them take this test with the glasses on or the contact lenses in, and you will just mark on your physical exam form that they are using corrective lenses. Okay, so when we're doing this test, one thing that we like to do is we like to test each eye individually and then test both eyes together. So for this first exam, I'm going to have him testing his right eye, so he's going to cover his left. The big thing is that you want to cup the eye. You don't want to put too much pressure against the eye that causes irritation. So just kind of cup the eye, and then we'll be testing his right eye. We'll go through it until where he makes like 1 or 2 mistakes per line. We'll get the number that corresponds with that. We'll test his left eye, then we'll test both together. All right, so go ahead and cover your left eye for me. Can you read line 1?
E.
Line 2.
FP.
Line 3.
TOZ.
4.
LP. ED.
Okay. Line 5.
PE. CFD.
Okay. And line 6.
Okay. EDF. CZP.
Okay, and then line 7.
FEL. D. PZO.
Okay. And so for his right eye, there's a couple of errors on line 7, so I'm going to mark down the number that corresponds with line 6, which is 20/30. And now I'm going to go ahead and have him cover his right eye, and we're going to test his left. So go ahead and cover your right eye for me.
Okay.
Go ahead and read line 1.
E.
Line 2.
FP.
Line 3.
TOZ.
Line 4.
LP. ED.
Okay. Line 5.
PE. CFD.
Line 6.
EDF. CZP.
Okay, and then line 7.
FEL. DPZO.
Okay, and so same result was there. A couple of errors on line 7, so I'm going to give him the measurement for line 6, which is the same thing, which is 20/30, which means he can see at 20 feet away. Most people can see at 30 feet away. That's how it translates. Now we're just going to test both eyes together to get a comparison with that as well. So go ahead, and you're just going to not cover either one of your eyes. We're just going to walk through the same test, okay?
Okay.
Go ahead and read line 1.
E.
Line 2.
FP.
Line 3.
TLZ.
4.
LP. ED.
5.
PE. CFD.
6.
ED. FC. ZP.
And then line 7.
FE. LO. PZD.
Okay, and line 8.
I can't see line 8.
Can't see line 8? Okay. So then I'll mark down that for both, when he's measuring both eyes, he gets to line 7 with no errors, which means he can see at 20 feet away, which most people can see at 25 feet away. So with both eyes in use, he can see a little bit better. Okay, so for this part of the eye examination video, I'm going to be using what is known as an ophthalmoscope to look into different aspects of his eye. The key here is that we're going to get 2 numbers that are unique to the examiner, and they are right here. When you turn the light on, it makes it a little bit easier to see they light up. And you're going to have a black or positive number, which shows you objects that are close up in clarity, and then a red negative number, which shows you objects that are far away with good clarity. So for me, to determine what I need to see close up, I'm going to have the light on, and I'm going to have my hand out, and I'm going to look at the back of my hand. I'm going to adjust until I see it clearly. And then once I see it clearly, I make a note of the number for my short view, which is, for me, it's a +3. And now I'm going to take it back to 0, and I'm going to find an object across the room, and I'm going to adjust it to where I can see the object across the room clearly, which will be my red or long view lens. Okay, and once I focus in on that, that's what's good for me, which is +3. So both my numbers are 3, which makes it a little bit easier for me to remember. I just have to make sure that I use the right lens, whether it's black for close up or red for far away. So now, with those numbers in mind, I'm going to use this to examine some features of my patient's eye. So we're going to start off with the black number, or the short view lens. And with this, we're just looking to see the iris, or what's known as your eye color. So that's all I'm going to be looking at with him. Normally, you want to be careful of how much light comes through the ophthalmoscope so you don't also blind the patient or do anything like that. But with this model, there's no real way to adjust the light. It's just kind of set as it is. So we're going to have to get close up with the patient, look through. We're going to check both eyes, and we're just kind of looking at the iris to see if there's any deformities, like I said, like any lacerations or things like that that are more superficial to the eye. So go ahead and cover there. Go ahead and open the eye. Okay. Alright. So just it's a superficial view, making sure that you look through the scope and you get pretty close to get a full view of what's going on. Everything's intact there. So now I'm going to switch to my red number, which is my far away view. And with this, we are looking into the back of the eye to see the retina, if there's a detached retina, which if that's the case, that's a surgical intervention that needs to take place, as well as looking at the optic disc, any blood vessels in there, seeing if there's any possible fluid accumulation that's causing pain for the patient. So making sure that we go to the red number, which is our far-sighted lens, which for me is also 3. And I'm going to make sure that I get close, and for this you have to make sure you get pretty close to the patient. So it's always good to let them know that in case this is the first time they've ever had an eye exam. And you're just going to make sure that you kind of keep it steady so you get a clear picture through the viewing window. Okay. Okay, so the biggest thing there is just making sure that you, if you're examining on the right side, you have the tool in your right hand. You kind of hold their face still to kind of keep yourself some separation, so that way you kind of hit your hands to know kind of that you're close enough, as well as making sure you keep your hands steady, so that way, because if you move too much, it'll be really easy to lose what you're trying to look at, which once again is the fovea, the optic disc, blood accumulation, things like that. So that is the last part of the eye exam video. We went through some palpations, some general examination of the structures involved, to see if there's any deformities, anything that's different bilaterally. We did a Pearl test for people's equal and reactive to light. We did eye tracking. We did Snellen eye chart, as well as an ophthalmoscope, to look at everything from the patient's vision to structures, both bony and internally to the eye, to see if there's anything that's maybe issues or nerve issues, and everything checks out just fine. But those are the steps involved in a basic eye exam. Thank you.